Stop talking about the Cubs. All right. Committee will come to order, and the chair recognizes himself for an opening statement. So this really is an important markup that we start with opening statements this afternoon, as way too many families across the country have experienced a loved one suffering from mental illness. And our committee is advancing meaningful reforms to our mental health care system that will better help these individuals and their families. This is an issue that, yes, impacts every community in one way or another. From the heartbreaking tragedy in Newtown, Connecticut that helped inspire this legislation to the senseless rampage that we endured in February this year in Kalamazoo, we continue to hear tales of great loss where intervention was lacking or non-existent. We have a bill, thanks, that'll be bipartisan, thanks to the exhaustive efforts of Oversight and Investigation Chairman Murphy to help families in mental health crisis. Those suffering from mental illness need the attention of this Congress, and for too many, our fragmented system of grants, prevention, treatment simply doesn't always work. So tomorrow, when we finish, the committee will consider legislation that achieves long-sought reforms to help address all of these issues. H.R. 2646, the Helping Families in Mental Health Crisis Act, includes new reforms to make sure that the federal government is leveraging their dollars with investments in evidence-based programs. The bill includes reforms to provide that the Substance Abuse and Mental Health Services Agencies, SAMHSA, new tools under the leadership of a new Assistant Secretary of Mental Health and Substance Abuse to do its job better. The bill will also provide accountability so that taxpayers can have more assurance that we're doing the very best with these critical dollars at SAMHSA to help those suffering from mental illness. H.R. 2646 calls on HHS to undertake rulemaking to ensure healthcare professionals can indeed communicate to caregivers. In some cases, healthcare providers simply lack an understanding of what the law allows them to do or not do to help patients suffering from mental illness. Additionally, 2646 includes new authorizations to expand treatment and expand our mental health workforce. This is critically important areas worthy of additional federal dollars and attention. Quite simply, if we need to be helping more folks at home, we need more trained professionals ready to do their job. The committee has spent considerable time, lots of time, on a bipartisan basis, trying to figure out the best way to enact meaningful reforms that will save lives, aid families, and provide comfort and relief to those struggling. That investment of time led to a strong bill that both Republicans and Democrats on this committee surely can be proud of. This markup is the culmination of a multi-year, multi-Congress effort. In the aftermath of the events across the country, Chairman Murphy got to work. At the time, mental health was a subject left for the shadows, and following an extensive O&I investigation that identified a problem, he commenced work on a thoughtful legislative solution. Throughout the process, we've achieved important reforms, most recently funding for the Assisted Opportunity Treatment Grant Program, AOT, in December's year-end spending package, and we also saw CMS expand settings for caring for the mentally ill in April. Thoughtful legislation takes time and dedication. This Congress, we've seen multi-year landmark efforts to make it across the finish line in SGR reform, updating our chemical safety laws, which is going to be signed into law in the coming days. 21st Century Cures has taken years. Pipeline safety, a good bill that passed the Senate by voice yesterday, and we continue to make progress. I'm hopeful that these mental health reforms that we've long pursued are on the same path to be signed into law. It's going to make a difference. Tomorrow, with what I expect will be a strong bipartisan vote, will mark another important milestone to delivering meaningful reforms, and I hope that the House will swiftly follow our lead. Particularly, I want to thank Mr. Pallone and members on the minority side, Mr. Kennedy, Ms. Matsui, Mr. Tomko, as well as our members that have really worked hard to get this bill in the shape that we have it in, ready to go tomorrow. And with that, I yield to my friend and ranking member, gentleman from New Jersey, Mr. Pallone, for an opening statement.
Thank you, Mr. Chairman. Today we are meeting to mark up an updated version of H.R. 2646, the Helping Families in Mental Health Crisis Act, At the legislative hearing on this bill, I expressed my hope that we could work together and find common ground to move bipartisan legislation forward that advanced the mental health system in this country. After months of hard work by both Democrats and Republicans, I'm pleased that we have been able to achieve that goal. It was no secret that there were significant differences of opinion on some of the key provisions included in the original bill that was marked up last year in the Health Subcommittee. But I want to thank Republican colleagues for continuing to meet with us and having the ongoing discussions needed to land at this bipartisan agreement. The bill we are considering represents a combination of the revised draft that Chairman Upton circulated on June 3rd, which eliminated policies that concerned many Democrats, and the addition of several provisions that Democrats advocated to make the final bill more meaningful. And these policies include new grant programs to address adult suicide and to create and disseminate model HIPAA training programs, and new provisions to strengthen compliance and enforcement of mental health parity. While I'm pleased with what we've been able to accomplish, I do want to be clear that I do not believe this bill represents a comprehensive mental health reform. Although it is a positive step forward, it is hardly a panacea for all the problems in our mental health system. For too long, our national infrastructure for treating mental health conditions has suffered from systematic fragmentation, neglect, and underinvestment. To truly address the resulting gap in our treatment capacity, we will need to continue to make sustained investments and improvements. And that means we must work to encourage all states to expand Medicaid and provide more resources to expand access to community-based mental health prevention, treatment, and recovery services across the country. And finally, Mr. Chairman, regardless of how comprehensive any mental health bill is, it's not a substitute for legislation to address the tragic instances of gun violence in this country. We're not going to begin to stop the violence until this Congress finally decides to address gun safety legislation. Again, I want to thank Chairman Upton, Oversight and Investigations Subcommittee Chairman Murphy, as well as the Democrats on the committee for all the hard work that was put into this important bill. I also want to thank Mr. Pitts and Mr. Green. I'm committed to working with you to see that H.R. 2646 gets signed into law. And I yield back.
Chair, thanks, gentlemen. The chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. I'll now recognize myself 3 minutes for opening statement. We have before us today legislation to help reform our nation's mental health care system. The legislation authored by our colleague, Representative Tim Murphy, is designed to help families and their loved ones struggling with crises caused by mental health disorders. The bill makes available much-needed psychiatric, psychological, and supportive services. With more than 11 million Americans who suffer with severe mental illness, such as schizophrenia, bipolar disorder, major depression, many are going without treatment, and often families struggle to find appropriate care for their loved ones. Since there is a patchwork of different programs and sometimes ineffective policies across numerous agencies, it's important for Congress to examine ways to fix the broken mental health system by focusing and coordinating programs and resources on psychiatric care for patients and families most in need of services. Over the past several years, Dr. Murphy, a practicing psychologist, has worked diligently on this legislation, and as chairman of the Subcommittee on Oversight and Investigations, Chairman Murphy launched a review of the country's mental health system beginning in January of 2013. The investigation, which included public forums, hearings with expert witnesses, document and budget reviews, and GAO studies, revealed that the federal government approach to mental health is a chaotic patchwork of antiquated programs and ineffective policies spread across numerous agencies with little to no coordination. The Helping Families in Mental Health Crisis Act of 2016, H.R. 2646, aims to fix the nation's broken mental health system by refocusing programs, reforming the way the Substance Abuse and Mental Health Services Administration administers grants, and removing barriers to care. One other important area I want to touch on today is the role of medication for those afflicted with mental health ailments. Medicare is one critical source of coverage for prescription drugs. Part D plans need to provide access to all, or substantially all, available drugs in the 6 classes that include antidepressants and antipsychotics. Getting these medications wrong can have serious negative consequences. In the past, Congress has rejected efforts to lessen this coverage, and I continue to believe we should not cut off access to critically important therapies. This legislation is a step in the right direction, and I thank my colleague, Dr. Murphy, for his years of hard work in this critical public policy area. With that, I yield back, and I now recognize Gentlelady Ms. Matsui, 3 minutes for opening statement.
Thank you, Mr. Chairman. We've been working on mental health reform legislation for some time now, and I appreciate the work we've done to bring us to the point we are today. The mental health crisis in this country is very personal to me, and I've been fighting for patients and their loved ones for many years. I believe there's a lot we can do to stop or slow down the hurt and pain that patients and families feel when mental health is left unaddressed. Our nation's mental health system is broken. As a society, we are still recovering from a history of pushing mental health into the shadows. The brain and the body are all part of the same person and need to be treated together. Parity between mental and physical illness should not just be a vision. It has to be reality for American families. We need to invest real dollars into a system that has been chronically underfunded for so long and bolster our behavioral health workforce so that providers are trained and available across our communities. We must make investments at all levels, ensuring that crisis services are available, but also that prevention and early intervention services are there to keep people from reaching that crisis stage in the first place. The bill before us today is a result of a bipartisan effort to make a dent in solving some of these systemic problems. I'm encouraged that we are able to work together to remove provisions that would have been harmful to patients. We have also come to agreement on many provisions that Democrats offered to make the bill more meaningful. The current bill includes our language to enhance the behavioral workforce, create suicide prevention programs for adults as well as youth, and strengthen SAMHSA. On HIPAA, I'm particularly encouraged that we work together to include my bill, H.R. 2690, which will provide clarity to healthcare professionals, families, caretakers, and patients on what information can and cannot be shared under the law. Through clarification and training, we can equip providers with the tools they need to share the right information at the right time while still protecting patient privacy. However, our work is far from over. We still have work to do when it comes to making sure mental health is integrated seamlessly into the healthcare system. That means confronting the fact that many community health centers can't bill for mental and physical health services on the same day, and behavioral health providers can't participate in programs that incentivize electronic health record systems. It means ensuring that seniors have access to effective mental health medications and that teachers, law enforcement, and the public have access to mental health first aid education about ways to recognize and respond to signs of mental illness. As I said, there's a lot more work to do on our path to comprehensive mental health reform. We are not solving every problem today, but this is a first step, and I do appreciate the bipartisan cooperation that we have been able to effect so far. Thank you, and I yield back.
Chair, thanks, gentlelady. Now recognize Dr. Murphy, 3 minutes for opening statement.
Mr. Chairman, the lead co-sponsor bill, Representative Eddie Bernice Johnson, asked that I could submit a statement from her for the record. May I do that?
Without objection, so ordered.
Thank you. Well, Mr. Chairman, today this committee takes a historic step towards advancing a bill that makes real reforms and offers evidence-based treatment for families in mental health crisis. Today, we are taking a stand. We affirm that mental illness is not a crime, mental illness is not a moral defect, it is not a choice, and it is not a joke. Mental illness is just that, an illness, and we affirm that psychosis is not a non-consensus reality. It is a symptom of an illness that with appropriate medical treatment is the difference between life and death. What we are doing here is historic. No committee has ever tackled the issue of serious mental illness with the depth of this bill today. In December 2012, we began a quest when America was shocked to hear of the tragedy at Sandy Hook Elementary School in Connecticut. For those children and families, we made a promise. We're going to fix the broken mental health system. For those innocent people in a movie theater in Aurora, the grocery store parking lot in Tucson, Wherever the perpetrator was someone with untreated mental illness, for the victims and the families, we made a promise to deliver treatment before tragedy. The same promise goes for the hundreds of thousands of homeless, imprisoned, addicted, and depressed individuals who die each day with untreated mental illness. It's tragic that these horrific events happen in a nation so advanced as ours. It's doubly tragic that many could have been prevented, and it's triply tragic that because inept and misguided federal policies are to blame for many of these deaths. Congress is not standing idly by anymore. It is time to say no more moments of silence. We must have treatment before tragedy and let people know that we will finally break down the stigma of mental illness, not through slogans, but through real evidence-based treatment, where people know if they get care, they can get better, because where there is help, there is hope. And tomorrow we vote to make sure that help is on the way. Because you cannot treat mental illness with denial, and you cannot treat it with sentencing a person to prison, or abandoning them in homelessness, or strapped to an emergency room gurney for days on end. For the victims, for the families, for the millions of Americans struggling with mental illness, please know we heard you. And tomorrow, after a long wait, we are keeping our promise to you and taking a strong stand to bring real care for mental illness. My heartfelt thanks go to Eddie Bernice Johnson, Congresswoman from Texas, for her steadfast work and dedication to this cause. To all of the 196 bipartisan co-sponsors, for all the professional organizations who have endorsed this bill and fought for real change, I thank you. Here and now, this committee jointly proclaims that the diagnosis and treatment of mental illness must come out of the shadows. We declare a new dawn of hope for the care of those with mental illness, and we pledge our unwavering commitment to continued work to bring help and hope in the future. I applaud and thank Chairman Pitts, Chairman Upton, and Ranking Member Pallone, and quite frankly, every member of this committee who came to the table in good faith, rolled up their sleeves, and worked together to see this through, because we recognize that without this, we would not see help. And where there is, and recognizing here too, that here today we're helping families in mental health crisis. And with that, I yield back.
Chair, thanks, gentlemen. Now recognize the gentleman from Massachusetts, Mr. Kennedy. 3 minutes for opening statement.
Thank you, Mr. Chairman. I want to thank Chairman Upton and Ranking Member Pallone, as well as the entire Energy and Commerce Committee staff for their dedication to addressing our broken mental health system. Chairman and Ranking Member have both solicited our priorities for this bill and worked across the aisle to address serious shortcomings in its original draft, and I'm grateful for that leadership. Congressman Murphy, thank you for your commitment to this issue. Your insight and expertise have been a critical part of this conversation. The bill before us today contains some important steps in our effort to address this country's mental health crisis. By eliminating outdated, discriminatory barrier in Medicaid laws, children under the age of 21 in certain IMDs will no longer be forced to choose between physical and mental health care. By funding a minority fellowship program, we can inspire more underrepresented students to pursue careers in mental health treatment. And by funding assertive community treatment, we can help equip community health workers with the help people need and can stay well. I'm heartened by the inclusion of these provisions and intend to support this bill as a step forward in our process. But I am disappointed that this is the only step that we could take. As it stands, this bill fails to address many of the most dramatic gaps across the continuum of care. It tackles the margins, not the meat, of a broken mental health system. At a time when over half the counties in the United States do not have a single practicing psychiatrist, psychologist, or social worker, this bill does little to address the fast-depleting mental health workforce. At a time when Medicaid is the single largest payer of mental health services in our country, this bill sidesteps ill-advised limits to care and the abysmal reimbursement rates that jeopardize access to treatment for our most at-risk populations. And most alarmingly, at a time when insurers deny mental health claims at twice the rate at which they deny physical health claims, this bill does next to nothing to strengthen parity protections. To focus on that parity point for a moment, we could build the strongest, biggest mental health infrastructure in the world. We could create thousands of new beds, hire thousands of new mental health workers, address interventions across the entire continuum of care. And none of that would matter if everyday Americans aren't able to get coverage for the services and treatment that the system would provide. Coverage means access. Coverage means affordability. Without coverage, millions choose to forego needed treatment, and millions more are forced to do without it. Our parity laws today lack teeth, they lack effectiveness, and they lack enforcement. By failing to address that, this legislation compounds one of the biggest barriers to adequate treatment that those suffering from mental illness and their loved ones face every single day. The bipartisan movement we have seen and we have made around this bill so far is encouraging, and I'm hopeful we can channel that into a more substantive reform in the days and weeks ahead. Thank you, and I yield back.
Chair, thanks, gentlemen. Now recognize the gentleman from Florida, Mr. Bilirakis, 3 minutes for opening statement.
Thank you, Mr. Chairman. I appreciate it very much, and I appreciate Chairman Upton holding this hearing. The Helping Families in Mental Health Crisis Act, of which I'm a co-sponsor, I want to thank Representative Murphy for his sponsorship of this very good bill. The bill will address much-needed mental health reform in our nation. I've held several roundtables in my district to discuss the struggles that individuals with mental health illness face and how Congress can best address the needs of those we serve. It's clear the shortage of treatment options and mental health professionals has resulted in too many mentally ill people becoming homeless or incarcerated. This is something that one of our local sheriffs, Chris Knocko, has been working to address. As a strong advocate for reform, Sheriff Knocko has been clear that the criminal justice system is not the appropriate place for those suffering with mental illness. Both he and Pinellas County Sheriff Bob Gaultieri have ensured that law enforcement officers receive crisis intervention training to help ensure sensitivity when dealing with the mentally ill. I would also like to acknowledge the work of Grace Maselli, president of the Pasco chapter of NAMI. She has shown tremendous leadership developing this chapter, generating community resources, and providing a voice for those who cannot advocate for themselves. Her work will be furthered by this legislation. I commend again Congressman Murphy for the extensive amount of time and attention he has put into addressing mental health and substance abuse disorders. He even joined me in my district to hear directly from my constituents about this bill. Thank you so very much, Congressman Murphy. We heard from many individuals, including Judge Sean Crane, who spearheads Veterans Court and Drug Court in Pinellas and Pasco counties. We also heard from Doug Leonardo of Baycare, who is working to simultaneously treat mental health and substance abuse, and Bob Dillinger, our local public defender, who has been a tireless advocate for those with mental illness. With their input, we work to address every aspect of this overall problem. I'm glad our committee has undertaken this endeavor to produce this bipartisan piece of legislation. I also have the honor of serving on the Veterans Affairs Committee, where we have focused on mental health issues plaguing our nation's heroes. A one-size-fits-all approach will not work for our veterans. It doesn't work for anyone. They deserve choice in treatment options and access to a wide range of alternative therapies. This bill before us today will not only benefit the general population, but our true American heroes and their families. Thank you again for moving this important piece of legislation, and I urge my colleagues to support this bill. Thank you, and I yield back.
Chair, thanks, gentlemen. Now recognize Mr. Tonko, 3 minutes for opening statement.
Thank you, Mr. Chair. I first met a constituent named Timothy O'Clair at a Little League game in 2001. Timothy was a bright and energetic youngster with the whole world ahead of him. Unfortunately, Timothy also suffered from debilitating mental illness. In fact, I believe he was triply diagnosed. When Timothy's insurance would no longer cover his mental health care, his parents were forced to disown him in order to get treatment. Unable to receive the appropriate care at the age of 12, Timothy tragically completed suicide. Timothy's struggle to get the care he needed is what first led me down the path of working to improve the mental health system of our country. 15 years later, I'm ashamed to admit that there are still far too many stories like that of Timothy across our country. Whether these events make the headlines or are one of the quiet tragedies that affect countless individuals and families, no one can credibly examine the status quo in mental health and say that it is working. Despite the pain that I hear coming from individuals and families in the throes of mental illness, I have a reason for optimism. I'm optimistic because today, after years of debate and countless hearings, we have arrived at a legislative product that would direct new funding and attention to mental health and represents a good first step. I say first step that will begin the work of patching up our broken mental health system. This bill is not perfect and necessarily represents a compromise from all sides. In particular, I would thank Representative Murphy for his doggedness and advocacy for those struggling with mental illness and for getting this bill to where it is today. I also thank Chair Upton and Ranking Member Pallone for their leadership to help us bridge the gaps and develop consensus on this critically important issue. I am pleased that this bill includes several provisions that I have worked on, including Section 502 regarding strengthening community crisis response systems. This provision would authorize a bed registry grant program so that states can develop and maintain real-time psychiatric and substance use bed registries that will make it easier for individuals in crisis to find appropriate treatment in a timely fashion. This new program will help to prevent future tragedies like what happened to Gus Deeds. Section 204 of this bill requires CMS to issue guidance to states on opportunities to use existing 1115 waiver authority to receive reimbursement for care provided at IMDs that are integrated into a comprehensive continuum of community-based care. This is a policy that I have worked on for a long time and am pleased to see advanced. It is critically important that care provided in inpatient psychiatric settings be part of a continuum of care connected to community-based services. Finally, I applaud the committee for recognizing the value of occupational therapists as essential providers in the mental health workforce through their inclusion in the strategic plan in Section 109. Occupational therapy as a profession got its start working in psychiatric hospitals, and OTs play a critical role in helping individuals with serious mental illness regain basic skills that are needed for day-to-day independent functioning. As this bill moves forward, I urge the committee to continue to recognize the important role that OTs play in the behavioral health workforce by adding OTs as behavioral and mental health professionals in the National Health Services Corps. As I said at the outset, this bill is the start and not the end to the conversation on improving mental health in America. We need to do more, very much more. We need to strengthen our mental health parity rates beyond what is in this bill. We have to address the fundamental inequities that still exist for mental health and federal health programs like the Medicare 190-day limit. Finally, we have to acknowledge that the current dysfunction in our mental health system stems in part from decades of broken promises and a chronic underinvestment in community-based mental health services that simply cannot be solved by a single bill. With that, I thank the committee again for its hard work and attention to this issue. And with that, Mr. Chair, I yield back.
Chair, thanks, gentlemen. Now recognize gentleman Texas, Mr. Olson, 3 minutes for opening statement.
I want to start by thanking Chairman Upton and Ranking Member Pallone for holding this markup, and my fellow sailor, Chairman Murphy, for his damn the torpedoes, full speed ahead attitude towards fixing our broken mental health care system. Everyone in America has felt pain from our broken system. We're all hurting from Orlando. I'm still hurting because I drove by Sandy Hook Elementary School as I was living in Newtown with my mom and dad waiting for the Navy to find my lost physical exam paperwork, the same Sandy Hook school where a deranged man killed 6 teachers and 20 kids 2 weeks before Christmas. I'm hurting because of a neighbor, Casey Owens. Casey joined the Marine Corps in 2002. He deployed to Iraq in 2004. A tank mine blew his vehicle apart. He lost both legs, had a traumatic brain injury, and post-traumatic stress disorder. It appeared Casey was beating his demons. He told a story nationally on 60 Minutes, an advocate for his fellow veterans, a Paralympic skier, moved to Denver. Casey tried to tell us how much pain he was in. He was still struggling. He told 60 Minutes, quote, "I could be in a room with 100 people and I would still be alone. I really don't think I'll ever be free. I don't think the burden of war is ever gone." End quote. Casey got his freedom and ended his burden of war by killing himself in September of 2014. And sadly, today, 22 combat veterans on average make Casey's same choice. They kill themselves. Chairman Murphy's bill is a first step on a long to stop any more Orlandos, Newtowns, or Casey Owens, and I intend to vote for this bill. But going forward in conference or another bill, I hope to include devices as part of the solution. A company, old Texas 22, LivaNova, used to be called Cybronics, has an implant that helps people with drug-resistant depression. CMS will not pay for the coverage with this device. Their search device is a device to control epilepsy, a vagus nerve stimulator. Epileptic seizures are not a pretty sight. The person collapses, the body locks up, trembles, you foam at the mouth, lose control of your bodily functions. When it's all over, you're exhausted, beat down. Imagine a kid going to school with epilepsy. One kid came to Cybronics. He was a freak boy in school. He had 50 seizures per week. Got the device implanted. Guess what? 1 seizure per week. He got his life back. He ended his depression. Let's take device into account going forward. I yield back.
Chair, thanks, gentlemen. Now recognize gentleman from Illinois, Mr. Rush, 3 minutes for opening statement.
I want to thank you, Mr. Chairman. Mr. Chairman, I also want to commend Chairman Upton, Ranking Member Pallone, Mr. Green, you, Mr. Chairman, and Mr. Murphy for your leadership on this particular subject. Mr. Chairman, I am sure, absolutely sure, that we can all agree that our nation's mental health system is severely broken and in dire need of modernization and expansion. In my home state of Illinois alone, emergency rooms, shelters, and jails are where the most severely mental health patients receive care. In fact, Mr. Chairman, the Cook County Jail has become the largest mental health provider in my state of Illinois. In the year 2012, of the approximately 76,000 people admitted to Cook County Jail, 45,000 had some form of mental illness. Mr. Chairman, these staggering statistics are evidence that the criminal justice system bears the heavy burden of our failure to fix our mental health system. Mr. Chairman, what is even more alarming is that 55% of the Illinois Medicaid population is comprised of mentally ill patients. Yet Medicaid reimbursement rates have remained flat with a severe shortage of psychologists and psychiatrists serving this population. Mr. Chairman, I want to again thank Mr. Murphy and Mr. Green for their leadership in addressing our nation's mental health crisis. I think this legislation takes a giant step in addressing the needs of our mental health population. However, Mr. Chairman, I am dismayed that yet again we do not include the requisite funding to implement many of the provisions in this bill. Nevertheless, Mr. Chairman, I would like to focus the remainder of my remarks on an important issue that I believe should be addressed in this legislation, and that is gun violence. Not just gun violence involving the tragedy of mass shootings and killings, but gun violence in general. So far this year, Mr. Chairman, in my city of Chicago, we've had 1,661 shootings and 277 homicides in my city alone. Mr. Chairman, day in and day out, people are living in a war zone, not knowing if they would be shot or not. Mr. Chairman, none of us are immune to gun violence. Most of the discussions regarding mental illness does not factor into how exposure to violence affects mental illness. Tomorrow, Mr. Chairman, I plan to offer an amendment that will require the Assistant Secretary to study the relationship and the potential impact of post-traumatic stress and substance abuse on children and adults living in communities that suffer from chronic community violence. With that, I yield back the balance.
Chair, thanks, gentlemen. Now recognize the gentlelady from Illinois, Ms. Schakowsky, 3 minutes for opening statement.
I am pleased that we've been able to make progress on this legislation. I want to thank you, Mr. Chairman, as well as Mr. Murphy and Mr. Green, Mr. Pallone, and Mr. Upton for that. This bill is remarkably different from the bill we marked up in the Health Subcommittee, and I'm thankful that the concerns raised by Democrats have been addressed and that we've been able to provide some new funding rather than cutting existing programs. However, I think we have missed an opportunity for real comprehensive reform. This bill is a step forward. But if Republicans had been willing to work with Democrats from the beginning, we might have been able to reach a comprehensive agreement. Despite the improvements in this bill, we still need to work to truly hold insurance companies accountable for mental health parity. We still need to expand and improve Medicaid, the primary payer in our mental health system. And we need to make significant investments in our mental health infrastructure if we truly want to guarantee success. Inpatient and outpatient mental health providers all across this country are struggling after decades of underinvestment, and yet we provide them with little in the way of additional resources. In fact, in this bill contains approximately 20% of the new resources included in the Democratic alternative bill, H.R. 4435. In addition, this bill does not include my legislation, the Mental Health on Campus Improvement Act. It is in both the Democratic alternative and the mental health bill that passed by the Senate Help Committee, and I hope we can work to include it in the final legislation. My bill would create a grant program to help colleges increase the mental health services offered to students, which we know are desperately needed on college campuses across the country. It really came out of a situation where one of my dearest friend's son committed suicide while at Harvard and has been a real priority for her and too many parents. Unfortunately, we all know how prevalent sexual assault is on college campuses, and as part of the response, we need to ensure that victims have access to the mental health services that they need. While I will support H.R. 2646, I need to be clear that this bill is not the end of the road, as so many of my colleagues have said in their opening statements. This is a step forward, but there is still much work to be done if we truly want to say that we've reformed our mental health system. I thank you, and I yield back.
Chair, thanks, gentlelady. Now recognize the gentlelady from New York, Ms. Clark, 3 minutes for question or for opening statement.
I thank you, Mr. Chairman. I thank Chairman Upton, Ranking Member Pallone, Mr. Murphy, Mr. Green, and Ms. Eddie Bernice Johnson for their hard work on this legislation. H.R. 2646, the Helping Families in Mental Health Crisis Act, is an important piece of legislation that strengthens and updates mental health laws and programs. It will help a range of Americans, from those who suffer from eating disorders to those suffering from more severe mental illnesses. However, I see this bill as an initial step in a more comprehensive reform of our mental health system, such reform which must include stronger, effective parity enforcement, appropriate authorization levels, and the full funding of this and any subsequent mental health legislation. Many of my Republican colleagues view this bill as being an answer to America's gun violence epidemic. However, I disagree with that assertion. In fact, a 2016 Health Affairs study noted that serious mental health illnesses contributes little to the risk of interpersonal violence. Rather, a mentally ill person is far more likely to have violence done to them or to self-harm than to inflict harm on others. An important aspect of the gun violence dynamic that is often overlooked is the adverse impact that exposure to gun violence has on victims and on the community's mental health. Studies have shown that communities exposed to gun violence have increased stress and PTSD. Children in particular are extremely impacted by gun violence. Specifically, the connection between community violence exposure and adverse academic performance usually include difficulties with concentration resulting from violence exposure, which in turn impair an adolescent's ability to learn in the classroom. Exposure to gun violence begins a cycle that has countless ramifications. We can break this cycle and curb gun violence by banning assault weapons, such as ones used in Orlando and the Sandy Hook school massacres, having enhanced background checks, often referred to as closing the gun show loophole, establishing a federal database to track guns, and requiring trigger locks or other safe storage requirements. These are sensible measures to curb gun violence while still allowing Americans to exercise their Second Amendment rights. We have let gun violence define us. America is more violent than any other OECD country except for Estonia and Mexico. We have let gun violence destroy our communities, not just in terms of the loss of life, but has also inflicted psychological damage, such as PTSD and depression, on our communities and in particular on our children. Rather than let gun violence continue to define us and destroy us, it is my hope that the gun violence epidemic plaguing our nation will embolden us, giving us the resolve to do the right thing for all those whose lives have been taken and disrupted by gun violence, to do the right thing for all the families who have lost their loved ones to gun violence, to do the right thing for our communities that live in fear of gun violence, and I hope that we have the political resolve to do the right thing for our nation. Common sense gun control legislation is needed now, and H.R. 2646 will only begin to scratch the surface of our national pathology. And I yield back.
Chair, thanks to the gentlelady. The chair now calls up H.R. 2646 and asks the clerk to report.
H.R. 2646, to make available needed psychiatric, psychological, and supportive services for individuals with mental
Without
illness.
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. We are now on H.R. 2646, and the committee will reconvene at 10 a.m. tomorrow. I remind members that the chair will give priority recognition to bipartisan amendments. I look forward to seeing all of you tomorrow. Without objection, the committee stands in recess.